Ladies and gentlemen, welcome back to the Think About It channel. Today we're doing an episode of Rejuvenate. You probably don't remember that one because we haven't done one in ages, but I found someone special for you this time. It's Susan Nolan. Susan, how are you?
Hi, I'm doing wonderful. Thank you for having me, Adam.
I'm so excited to have you because you're doing some cool stuff. Susan is the founder of Discover Health. She's a registered nurse with over 20 years of experience in the nursing field, and her business, Discover Health, offers skilled health management, cost savings, preventative health programs, medical navigation assistance, advocacy services, prevention and wellness programs, as well as small business healthcare management. If it's health and business related, she's your woman. She's got your back. So Susan, let's sort of go back to the starting point before we get into all the big and wild and medical things you're doing. So going back to the basics, what inspired you to go into nursing?
Well, back in the early 90s, there wasn't enough nurses, and they were looking for people. And so I decided to look into that. I was working as an administrator in a business office, and I needed something more. I just needed something more that would give me purpose in my job. So I decided to volunteer at the local hospital. And I did that for a few months to get an idea if this is really what I wanted to do, because I had already kind of established myself in the work world, and I was raising a family. So I couldn't make a jump into a new career without making sure it was going to be one that I wanted to do. And after I started, I found out that I just absolutely loved nursing, everything about it. And as I went through my career and my education, I found out, how much it fit me well, of helping people and making them, helping them get well, or even helping them deal with the death of a loved one. Nurses do a lot of things, and we have good connections with people, and I think that's what inspired me to go into nursing.
Very nice.
Yeah.
So I'm a teacher, and this
Mhm.
is sort of segueing into the next question.
Okay.
I'm a teacher, and I have no itch to sort of climb the ladder and become an administrator or a superintendent or
Mhm.
anything. But you have climbed the ladder, so they say. Um, how did you find yourself going from your role as a nurse to then becoming a clinical nurse manager, and then later the director of clinical operations and a director of nursing?
Yeah. Oh, well, I like to continue to learn. I'm a lifetime learner, and I always like to the next challenge. And I found that in nursing there was a lot to patient care, but the next level was management, and it was to bring people together. And one of the things that I've always liked doing was working with a team. And I felt that, after getting some experience, that I really felt that I could do some good with teams, leading teams. Once I started doing that, I saw I had mentors in the nursing industry that, kind of inspired me to go on further into directorship. I just found it more interesting. I do have, somewhat of a business background. So going into the next level of directorship was bringing together my business experience as well as my nursing experience. So it was nice to be able to, put together programs and, different things to help people get access to care, patients get access to care. That was our big push there. As you know, it's tough out there for people.
One of the many reasons why I wanted to have you on, because I am fortunate as a public educator in the state of New Jersey. I have very nice health insurance,
Yes.
but I know for the vast majority of people that is
Mhm.
not the case.
Mhm.
So when
Yeah.
when your name came across my email, I'm like, I got to talk to this lady and see if hopefully someone can see this video and reach out to you for some support when it comes to the medical insurance field, because it's
Yeah.
a crazy one.
It is what I call a hairball out there.
I might not use that word. I might use a more derogatory word for it, but it is definitely a hairball out there
It
for
is a
sure.
hairball. Yes, it is. And you have to kind of untangle it all the time. There's always,
And it's constantly more hair is constantly being added, and it's different strands of hair, and they're different people's hair, and they're different thicknesses, and the tools you use are you got to be different tools now because it changes all the time.
sometimes you just got to take scissors to it.
And sometimes you just got to take some scissors to it for sure.
That's true. That's true.
So I wanna lead into our next question with like a little story.
Okay.
So I started this channel. We were sort of talking about this off camera a minute ago. I started this channel to promote people in our area that do cool things that people don't always notice.
Hmm.
So it really started with I had a lot of colleagues as a teacher that did their side hustles
Yes.
were like really interesting and really cool, and people didn't know about it because like we're teachers full time.
Hmm.
So I've done interviews with colleagues. I'm gonna name drop here a little bit. My buddy Kevin Finn's an English teacher, but he
Hmm.
has also written a book on table tennis and sports health. And he's like a table tennis coach. I have another buddy, Rob Demidio. He is a teacher, but he also has now started a bariatric support business and support group. So he was in some serious health issues with his health and had bariatric surgery, and now
Hmm.
he is leading a flock of people to do better with their own health post bariatric surgery. So
People
this
do.
channel sort of started out from highlighting people that would not be highlighted
Hmm.
otherwise.
Yes.
And that was sort of my inspiration to start this channel.
Hmm.
So I tell you that to ask you, was there a specific moment or a specific case you came across as a nurse or in one of your nursing titles that drew you to start this business of Discover Health?
Well, throughout my career, I found that there were, say, elderly patients who didn't really have family, or they were estranged from family, or the families were confused as what was going on. As nurses, we are advocates. We are trained to be advocates for patients. Stand up and make sure that they're getting what they need. Um, so many times I would help case manage them. I was a case manager. I did home care um, as well in the clinical management areas. Um, so with that, my husband had gotten sick. What happened was I always wanted to start a business after I finished my master's degree, and I couldn't decide on really what I wanted to do. So in the interim, my husband had developed a chronic illness and needed a liver transplant. At that time, I was on the other side of the bed. And in other words, we were receiving the care instead of me giving the care. And it really opened my eyes to what patients go through. The uncertainty, nobody's giving answers. The doctors, there's 20 doctors that came in. I'm not sure who's who or what's going on. It, is my loved one going to be okay? What's going to happen? Um, as a nurse, we're trained to critically think, and thinking means to ask the questions, ask as many questions as possible. So going through that experience with my husband, my sister-in-law had said to me, what do people do that don't have somebody like you that's asking those questions and getting the answers and making sure things are done? And it started me to think, like, this is something that maybe I could do to help people. And I was looking for something to do in my retirement, basically. But I started before I retired as part-time and worked part-time as a instructor for LPNs. So that kind of pulled me in. Once the light bulb went off, I said, I know there's people out there that need somebody to be there with them in that doctor's office or in that hospital ER or in that hospital bed that's going to say, wait a minute, do you really know what's going on with this patient? Sometimes they don't know all the ins and outs of what the patient is going through. Even simply just telling them, look, this guy has been in and out of the hospital 5 times in the past 6 months. Can you, be a little bit more kinder to him, or, give him a little bit more love. And the people that are in the healthcare industry do have the empathy and the caring. It's just that sometimes you just have too much work to even think about those things. So many times I'll work with the nurses and just say, don't forget, he's got his birthday coming up, or this is what happened. This is his back history. You know, even though we have the electronic medical record, many times there are things that don't get passed on, or people don't have the time to dive into that chart. So giving them that synopsis, like, hey, this is what's been going on, and this is where we are now, it does help the doctors and the nurses take better care of the client.
Yeah, for sure.
Yeah.
It's nice to have someone in your corner who can do that, especially if you personally can't.
Yes.
Can you give us a brief overview and sort of like simple people terms as to the different services you offer at Discover Health?
Well, I offer several. First of all, I work exclusively for the client. I don't work for the insurance company. I don't work for the healthcare system. So, with that said, I work with each client individually as to how they want their healthcare to go. I learned that as a home care nurse, because in the hospital, I'm not sure if you've ever had a loved one in a hospital or if you've been in yourself, that you're at our mercy. We tell you when you're going to eat, when you're going to get washed, when you're going to get your meds. In the home care setting, it's a little different. And you learn to listen a little bit more about what they really want. Do they really want what the doctor's prescribing? Or do they want to hold off? Or do they want to not take that medication? So those are some of the things that I would educate them on. So there's a lot of medication management and educating, because if somebody says, I don't want to do that, well, let me at least give you the information so you can make a educated decision. So I do research. I accompany my patients to the doctors, or if they're in a hospital, I come to the bedside, make sure that we have a good conversation with the caregivers, if they're in the ER. And I also do care coordination. So once we go to the doctors, or say a specialist, I help find people, their doctors as well. I'll research. And so we'll have a set of questions ready for the doctor when we go in. And it makes it so much easier to know exactly what to tell the doctor, what to ask the doctor, and what you want to get from that visit. As a director of clinical nursing, I had overseen a physician practices at Kennedy Health System when they were still around, and and we knew that we only were giving doctors like 15-minute intervals of visits. So knowing that ahead of time, I would say let's write these questions down so you know exactly what to ask, and it makes it go faster, and it makes the doctor more on track and focused on what you're there for.
Yeah. That's huge.
Yeah.
Having a game plan going in.
Yes, you have to, absolutely. Yeah, because you'll forget. You'll get in there and you'll say,
oh yeah,
wait, I did want to ask you something, but I can't remember what it was. Mm-hmm. So even making sure that they received your blood work before you went, or things like that, so that when you go in, you're getting value out of that visit. It's I've come out of visits sometimes and was like, I don't even know what we talked about. So right. Yeah. So sometimes if it's not me with you, you should have someone with you.
Just to maximize everybody's time,
Mm-hmm.
I mean, let's be real. You go to the doctor's office, it's not the most speedy place in the world. You're probably taking a day off yourself if you're working to go there, and you're probably sitting there for 45 minutes in the waiting room. Mm-hmm. And then, like you said, you might only get 20 minutes with the doctor. Mm-hmm. And God forbid you forget your question on the way there. And then you walk out like, I don't know, I just paid a $15 copay, or if you're lucky, I don't know what happened.
Right. And it does make a better interaction with your doctor.
Yeah,
I think
for sure.
Yeah, because they have to, I think that they also come in focused on what they have to do. And sometimes I always let the doctor take the lead, but then before we leave that visit, we're asking those questions and making sure we're getting our answers. And I think the doctors appreciate it too.
Sure. Yeah. Is there a specific clientele you serve?
Anyone who 18 and older.
Okay, cool.
I don't do adolescents or children. I've always worked with adults and senior citizens. So I've had clients as young as in their 20s, as old as in their 90s. Um, so you get a real different mix of people. It depends. Most people have usually conditions that are chronic, that, or something that's rare that they just, need help navigating.
And I know you're based in Oakland, New Jersey. I used to
Yes.
live there.
Oh,
And for those of you not familiar with that area, that's Camden County. So what areas of the area do you serve?
well, I do most of New Jersey. I try to stay under 100-mile radius. I've done, actually, I can do anything like remotely. I have a client in Austin, Texas. I had a client in California. And those clients, I did a lot of telephonic uh, nursing with. So I would be, calling their insurance companies or, coordinating with their doctors, setting up their appointments, or if they needed transportation, things like that.
Mhm. So to sort of wrap things up, I have one last like sort of interviewee question for you.
Okay.
Um, in the craziness that is our healthcare system,
Yes.
what is one piece of advice or insight you could give to anybody watching this right now in terms of their healthcare?
Well, I think I could give you a few, but I think one of the things is preventative care. Where everyone's a little lax on making sure they're up with their mammograms, colonoscopies, blood work. Um, to stay healthy, I think you have to put the work into it. Um, in this health system, you have to be engaged. You have to be on the team, 50%. I always would tell my clients and my patients, we're a team, 50-50. I'm giving you 50, you're giving 50. So that, that you're many times people say, whatever the doctor says, well, no, how do you feel about that? Well, do you really want that? So know yourself, first of all. Um, be a participant, but also make sure that you have a relationship with your doctor, that you can, really have those heart-to-heart talks with at times that you need to. So my advice would be to, be a participant in your own care. Don't, if something's not right, I've heard many times where people, even younger people, we just had someone pass away, a young person who the doctor dismissed her symptoms. It happens many times, especially to younger women, and younger people. I should say younger people in general, because they're like, you're only in your 20s or you're only early 30s, you shouldn't have any problems. So if someone is dismissing you, don't give up on it. Always seek to make sure that that is the correct diagnosis. So that's what I would recommend.
If this interview has resonated with someone and they're like, man, I gotta get that lady on the horn and start getting my healthcare together, where can people learn more about you and Discover Health online?
Well, I do have a website. It's called discoverhealthadvocacy.com. You could call me as well. My office numbers, should I put up a sign?
I'll put everything in the description, but if you want to say it aloud.
Yeah, I'll say, okay, 856-957-5440. And you can leave me a message. If I don't answer, I get back to people right away. If you have a question, I do a free 30-minute consultation just to see if there's resources or something that you may need, or just a question answered. One of my passions is helping people feel better. So,
well, Susan, thank you so much for taking the time
thank
to talk
you,
to me
Matt.
today.
It was a
And
pleasure.
people, there's help out there. You just got to ask for it.
Mhm.
It's not easy navigating this health field, but there's people in your corner. Susan's in your corner. Give her a call.
Absolutely.
Shoot her an email.
Absolutely.
Hit her up. Thank you so much, Susan. I'm looking forward
Thank
to
you.
talking to you again at some point.
Yes, I appreciate it, Adam. Thank you very much.